So hello everybody. So let's discuss the other three anomalies of male penis. So first we will discuss the Peyronie's disease, then we will go with the phimosis, and lastly with the balanitis. Okay. Now in the Peyronie's disease, what happened? This is occurred due to injury while having the sex, a trauma, or due to a genetic effects. Okay, and if the person is also taking the beta blockers enormously, they can also cause the Peyronie's disease. Okay, so what happened? This is the tunica albuginea. Okay, this is tunica albuginea. So in the tunica albuginea, you will find out the fibrous plaque which is surrounding the corpus cavernosum, and this fibrous plaque will be cause the curvature, the penile curvature. Okay, you can see how the penis look like. Okay, so this is the condition the person find out really pain while having the sex, while urinating, and this is very harshful condition. Okay, and we cannot do any surgery with the Peyronie's disease. Okay, then about the phimosis, that the phimosis is a condition when the prepuce, okay, this is a prepuce that is known as the orifice of the foreskin, and this prepuce becomes so smaller by which the normal retraction of penis cannot be held. Okay, and you can look like how the penis look like now. Okay, this is a normal one, this is the abnormal condition. Okay, so this is generally due to the poor hygiene. It is generally due to the congenital or the physiologic effect on the body. And what happened, like when the penis is not retracting properly or not circumcised properly, there is a formation of infection inside the inner skin of the foreskin, and that repeated infection, the infection is there, so that will cause the scars. Okay, and that scars leads to the phimosis, paraphimosis. Okay, so what are the complications is that if the person is doing the sex, the person will find out the pain during the sex, and that is known as a dyspareunia. Okay, and they will be also having the urinary problems, urinary tracts infections, or urinary problems while urinating. The person find out the pain, okay, while urinating. But the most important thing and good thing is that with phimosis we can treat with the surgery, and we can do the circumcision. Okay, to remove the skin, we will remove the skin, and we can treat the patient. Okay, in the case of balanitis, okay, this is the like an infection, and it is generally caused by a lot of organisms, but the most important we have the C. albicans, then anaerobic bacteria, pyogenic bacteria, and the gardnerellas. Okay, in melanitis what happened, that this is generally related to the poor hygiene. Okay, because of poor hygiene, and the person cannot circumcise properly, the person is not taking care of the penis and the genital area, so this is causing the balanitis, this infection. So what is the condition in the balanitis? Most important thing we have to remember, that there is a formation of smegma. Okay, the smegma means these squamated cells, the debris, the cells which is abnormal size, the sweat glands were there, the inflammatory cells were there, the moisture is there, and it looks like white in color. Okay, this is smegma. Okay, and this balanitis, this is really painful condition, EG condition for our patient, and this balanitis can be leads to phimosis. Okay, that leads to phimosis. The phimosis, we just talk about the phimosis. This is phimosis, and this balanitis leads to phimosis. Okay, and we also can do the surgery. We also treat by the medications in the balanitis. So for balanitis, we have to remember the smegma, the organism which is causing the balanitis predominantly, and this is really important, that the balanitis will be occur in those patients predominantly who are not taking care of the genital areas, where usually the uncircumcised man. Okay, okay. In phimosis, we have to know about the normal things like dyspareunia is the complications and all, And in the Peyronie's disease, we have to know that what is the particular location for the fibrous plaque. So this is not that much important topics, but we have to know about the basic things about all three anomalies of the penis. Now we covered all three anomalies, so hopefully you will find out that this is really helpful for you. And thank you so much for giving your time and watching this video. Thank you.